Dear students, my name is Nidhi Singh and I am from Tata Institute of Social Sciences, Hyderabad. In the current module, I'll be discussing with you about the reproductive health. According to WHO, reproductive health addresses the reproductive processes, functions and systems at all stages of life. Reproductive health, therefore, implies that people are able to have a responsible, satisfied and safe sex life, and that they have the capability to reproduce and the freedom to decide if, when and how often to do so. Sexual health requires a positive and respectful approach to sexuality and sexual relationships, as well as the possibility of having pleasurable and safe sexual experiences free from coercion, discrimination and violence. For sexual health to be attained and maintained, the sexual rights of all persons must be respected, protected and fulfilled. With the above understanding, the concept of sexual and reproductive health has been widened by including biological and social factors. It has equality and equity among partners. But the issue of reproductive health varies among regions and populations. This is again related to socio-cultural aspect of the people. In some issues related to reproductive health, the environment also plays a significant role, while the genetic influence on reproductive behavior has been well recognized. To maintain one's sexual and reproductive health, people need access to accurate information and the safe, effective, affordable and acceptable contraception method of their choice. They must be informed and empowered to protect themselves from sexually transmitted infections. And when they decide to have children, women must have access to services that can help them have a fit pregnancy, safe delivery and a healthy baby. Every individual has the right to make their own choices about their sexual and reproductive health. UNFPA works to ensure sexual and reproductive health and rights remain at the very center of development. The International Conference on Population and Development draws a clear connection between reproductive health, human rights, and sustainable development. When sexual and reproductive health needs are not met, individuals are deprived of the right to make crucial choices about their own bodies and futures, with a cascading impact on their families' welfare and future generations. And because women bear children and also often bear the responsibility for nurturing them, sexual and reproductive health and rights issues cannot be separated from gender equality. Cumulatively, the denial of these rights exacerbates poverty and gender inequality. UNFPA also works to prevent and address STIs, which take an enormous toll around the world. More than 1 million people acquire an STI every single day. Without diagnosis and treatment, some STIs, such as HIV or syphilis, can be fatal. STIs can also cause pregnancy-related complications, including stillbirth, congenital infections, sepsis, and neonatal deaths. STIs like human papillomavirus HPV can lead to pelvic inflammatory disease, infertility, and cervical cancer, a major killer of women. The Lifecycle Approach. Reproductive health is a lifetime concern for both men and women from infancy to old age. Evidence shows that reproductive health in any of these life stages has a profound effect on one's health later in life. UNFPA supports programs tailored to the different challenges people face at different times in their lives, including comprehensive sexuality education, family planning, antenatal and safe delivery care, postnatal care, services to prevent sexually transmitted diseases, including HIV, and services facilitating early diagnosis and treatment of reproductive health illness, including breast and cervical cancer. To support reproductive health throughout the life cycle, services across a variety of sectors must be strengthened, from health and education systems to even transport systems, which are required to ensure that healthcare is accessible. And all efforts to support sexual and reproductive health rely on the availability of essential health supplies, such as contraceptives, life-saving medicines, and basic medical equipments. Good reproductive health for all will only be achieved through an approach which places people rather than problems or interventions at the forefront of action. This means a greater involvement of people in their own healthcare and an understanding of reproductive health in the context of an individual's lifespan and their own cultural, social, economic, and physical environment. In addition, political will is needed if we are to turn away from the problem-specific and vertically organized healthcare systems of today and transform the concept of truly comprehensive reproductive healthcare into a reality. In practice, the implementation of strategy to achieve this will require priority settings, especially given the ongoing, indeed worsening, resource constraints. It is not possible to do everything immediately and to do it all well. Countries must instead identify their main concerns using a participatory and community-based approach and must direct their efforts toward a few priorities and towards accomplishing them well. The attainment of reproductive health will require accessible and acceptable quality services and technologies, the participation of other agencies in the judicial, economic, educational, and social sectors, and equity between the sexes. We need to constantly remind ourselves that reproductive health is not simply a biomedical issue, but an issue with serious implications for general health and by extension for all our efforts in human, social, and economic development. A shared understanding of reproductive health will have to be developed through national and local consensus building in order to lay the foundations for dialogue and program development. The purpose of advocacy is to draw a community's attention to the issue of reproductive health and to point decision makers towards nationally relevant solutions. Advocacy involves reaching out to many people in many positions, translating the concepts and content of reproductive health into readily understood information appropriately communicated to different constituents. Such information will have to be adapted and disseminated through public, political, and professional at local, national, and international levels. A public health approach to reproductive health within the context of primary healthcare is important if the concept is to be translated into a reality for people. Such an approach responds to people's needs and involves them in program formulation, implementation, monitoring, and evaluation so that a strong feeling of ownership is established. It seeks sustainable programs and actions that have the greatest impact for the most people at an affordable price. The guiding principles are those of human rights, ethics, equity, quality of care, participation, partnership, integration, optimal use of resources, and sustainability. The concept of reproductive health presents a challenge in terms of the development of strategies that move beyond traditional ways of thinking about reproductive health conditions and services. The challenge is to develop a global strategy that will establish a policy framework for national and international efforts to help people promote their own sexual and reproductive health and that of their partners, prevent reproductive health problems, and provide care for the millions of women, men, children, and families already affected by reproductive ill health. It will be necessary to mobilize concerted and sustainable action to meet the challenge of ensuring reproductive health for all. Any approach to promoting reproductive health which attempts to link the different components of existing healthcare services is dependent upon a number of intermediate steps. To succeed, calls for a continual expansion of the knowledge base through research, the culling and dissemination of information, the use of sound data for advocacy to strengthen policies and programs which promote reproductive health, a revision of training to match the new vision of reproductive health, the streamlining of services, and the involvement of users in their planning and management, and monitoring and evaluation to measure the effectiveness of new approaches and extend what works best. WHO has a responsibility to provide vision and leadership in the development of such an integrated approach to reproductive health. The United Nations in 2011 emphasized the importance of reproductive health and development in a report titled Fertility and Reproductive Health at the Core of Development. Fahimi and Ashford in 2005 explained the importance of investments in reproductive health to achieve development. Pachauri in 1998 explained the reproductive health framework. She suggested that the reproductive health ideology and ethos is effectively internalized and programs responsive to clients' needs are designed with the active involvement and participation of all stakeholders. Berer in 2003 suggested that sexual and reproductive health should be integrated under common health priorities. Paul 2011 discussed reproductive health, child health, and nutrition under the universal health coverage of India. They inferred that it needs the political commitment from the highest order and the development of a people's movement. Reproductive health issues in India vary and are linked with different factors. Pachauri 1999 explained the issues related to implementing the reproductive agenda in India. Pachauri explained the issues related to implementing the reproductive agenda in India. Saneving discussed that economic status, gender, and social status are all closely interrelated when influencing the use of and access to maternal and reproductive healthcare in India. Adolescent sexual and reproductive health is an important section in reproductive health dynamics. Given regional diversity and marginalization, vulnerable groups like adolescents become receivers of various cultural and traditional practices. In these aspects, adolescent marriages and motherhood make researchers look further to understand the web and evolve strategies. Gigi Bhaus studied sexual and reproductive health of adolescents in South Asia in the context of towards adulthood. Maternal health care seeking behavior among tribal adolescent girls was studied by Sandhya Rani in 2007. UNFPA in 2014 discussed the importance of adolescent sexual and reproductive health. The reproductive health deals with some of the following core issues, and these issues play a key role in addressing the reproductive health. First, adolescent sexual and reproductive health, fertility regulation, gynecology, infertility and cancer, HIV/AIDS, improving health system performance, newborn health, preconception, pregnancy, childbirth and postpartum care, sexually transmitted infections, sexual health, human rights and gender equity. Adolescent sexual and reproductive health. Now we'll look at these topics one by one. First one is adolescent sexual and reproductive health. Adolescence, transitional phase of growth and development between childhood and adulthood. The World Health Organization defines an adolescent as any person between ages 10 and 19. There is a growing recognition of the importance of addressing the sexual and reproductive health of adolescents. Adolescents' reproductive health promotion needs to receive proper attention in order to protect young people from adopting risky behaviors that could negatively affect their health. During adolescent period, biological, physical changes take place. Attaining puberty, secondary sex organs growth spurt, all occur during the adolescent period. The chances of unprotected sex can lead to adolescent pregnancy. Further complications are all related to adolescent reproductive health. Fertility regulation. Effective fertility regulation actually has the potential to contribute to better maternal health beyond simply reducing the proportion of births that are unwanted. Increased use of fertility regulation to avoid unwanted pregnancy will lead to a decrease in the number of induced abortions in the country. The couple need to understand and decide their family size. They have to provide proper knowledge related to fertility regulation, which in turn uphold the safe maternal health. The concept of family size norms and government services related to maintaining family size has to reach the community. Gynecology, infertility and cancer. Gynecology is the medical practice dealing with the health of the female reproductive systems, vagina, uterus and ovaries, and the breast. Literally outside medicine, the term means the science of women. Infertility means an inability of those of reproductive age between 15 to 49 years to become or remain pregnant within 5 years of exposure to pregnancy. An inability to become pregnant with a live birth within 5 years of exposure based upon a consistent union status, lack of contraceptive use, non-lactating, and maintaining a desire for a child. Cancers can occur in any part of the female reproductive system: the vulva, vagina, cervix, uterus, fallopian tubes, or ovaries. These cancers are called gynecologic cancers. The gynecologic cancers can directly invade nearby tissues and organs or spread metastasize through the lymphatic vessels and lymph nodes, known as lymphatic system, or bloodstream to distant parts of the body. HIV and AIDS. The unprotected sex can lead to HIV. Condoms and lubricants are the best ways to prevent HIV infection during sex. Taking treatment when pregnant will help to protect your baby from HIV. Improving health system performance. Performance measurement offers policymakers a major opportunity to secure health system improvement and accountability. Health services availability at grassroots level show its performance level. The personnel involved in delivering the services and their accessibility to people relate to the healthcare services. The accountability and transparency in financial matter is also a prerequisite. The infrastructural conditions at health centers show the outcome of performance. The community satisfaction for the health services they receive indicate the functioning of the health system. Its role is to improve the quality of decisions made by all actors within the health system, including patients, practitioners, managers, government at all levels, insurers, and other payers, politicians, and citizens as financial supporters. Newborn health. A newborn infant or neonate is a child under 28 days of age. It is thus crucial that appropriate feeding and care are provided during this period, both to improve the child's chances of survival and to lay the foundations for a healthy life. Preconception. Preconception care is the provision of biomedical, behavioral, and social health interventions to women and couples before conception occurs. It aims at improving their health status and reducing behaviors and individual and environmental factors that contribute to poor maternal and child health outcomes. Its ultimate aim is to improve maternal and child health in both short and long term. Pregnancy, childbirth, and postpartum care. Pregnancy means the period from conception to birth. After the egg is fertilized by a sperm and then implanted in the lining of the uterus, it develops into the placenta and embryo, and later into a fetus. Pregnancy usually lasts 40 weeks, beginning from the first day of women's last menstrual cycle, and is divided into 3 trimesters, each lasting 3 months. Childbirth. Childbirth includes both labor, the process of birth, and delivery, the birth itself. It refers to the entire process as an infant makes its way from the womb down the birth canal to the outside world. Postpartum care. Postpartum care encompasses management of the mother, newborn, and infant during the postpartum period. This period usually is considered to be the first few days after delivery, but technically it includes the 6-week period after childbirth up to the mother's postpartum checkup with her healthcare provider. Immediately following childbirth, a new mother experiences profound physical and emotional changes. She may stay in the hospital or birthing center for a very short time, as little as 24 to 48 hours after delivery. The physical and emotional care a woman receives during the postpartum period can influence her for the remainder of her life. During the postpartum period, the mother is at risk for such problems as infection, hemorrhage, pregnancy-induced hypertension, blood clot formation, the opening up of incisions, breast problems, and postpartum depression. Sexually transmitted diseases. Sexually transmitted diseases or STIs, also known as sexually transmitted infections, STDs, or venereal diseases, VD, are diseases that are passed on from one person to another through sexual contact and sometimes by genital contact. The infection can be passed on via vaginal intercourse, oral sex, and anal sex. The information related to STIs need to reach all sections of the community. The stigma related to this has to be clarified so that any person can share the matters related to STIs. Sexual health. Sexual health is a state of physical, mental, and social well-being in relation to sexuality. It requires a positive and respectful approach to sexuality and sexual relationships, as well as the possibility of having pleasurable and safe sexual experiences free of coercion, discrimination, and violence. The awareness related to sexuality and sexual health can contribute positive outcomes of reproductive health. Human rights and gender equity. To produce greater health outcomes through the advancement of the right to health and other health-related human rights, the right to the highest attainable standard of health requires a set of social criteria that is conducive to the health of all people, including the availability of health services, safe working conditions, adequate housing, and nutritious food. Realization of the right to health is closely related to that of other human rights, including the right to food, housing, work, education, and non-discrimination, equality, access to information, and participation. The right to have appropriate reproductive health services is every individual's right. The reproductive health rights are for every person in the society. Gender. It refers to the socially constructed characteristics of men, women, such as norms, roles, and relationships of and between groups of women and men. It varies from society to society and can be changed. While most people are born either male or female, they are taught appropriate norms and behaviors, including how they should interact with others of the same or opposite sex within households, communities, and workplaces. When individuals or groups do not fit established and gender norms, they often face stigma, discriminatory practices, or social exclusion, all of which adversely affect health. It is important to be sensitive to different identities that do not necessarily fit into binary male or female categories. To ensure that different groups of women and men, boys and girls have equal opportunities to achieve their full health potential. The matters related to reproductive health and sexuality have no place for gender discrimination. The services has to be provided irrespective of any gender. Equity refers to the fair opportunity for everyone to attain their full health potential regardless of demographic, social, economical, or geographic strata. The progressive realization of the right to health involves a concerted and sustained effort to improve health across all populations and reduce inequities in the enjoyment of health. Inequities are inequalities that are judged to be unfair, that is, both unacceptable and avoidable. Reproductive health services should be inclusive and all sections receive its benefit to achieve its goals. Given the relationship between reproductive health and development, as highlighted in the United Nations Millennium Development Goals, and that the sexual and reproductive health rights of the individual in any country represents a country of development of that country. Thank you.